Everything we do is to prevent breast cancer from occurring in the first place. We bring everyone who's pink across the state of Texas together to collaborate, to network, and share resources.
The mission of the Breast Health Collaborative is really to unite Texans interested in breast health care so that we can educate, navigate, and advocate for issues related to breast cancer.
It is a forum for exchange and to share those resources so that you as an individual organization or as a hospital or as a survivor can make your own choices.
The more exposure that women have to the different medical resources that are out there, the better off they'll be.
The most important thing that comes out of this organization is the creation of partnerships between individuals, organizations, and building a stronger community.
The Breast Health Collaborative of Texas's goal is to leave all of the organizations that we came with at the door and just focus on the women of Texas who are going through a breast cancer diagnosis.
One of the tenets of our mission is navigation. And we find that we navigate best through certified community health workers.
These are the folks that are out in the community. Their purpose is access, helping patients, clients access the services they need.
A lot of patients aren't aware of the resources that are available to them. What we do is we go out and we educate them, and literally kind of holding their hand and guiding them, doing whatever it takes to get it done.
We want to give access to women who would otherwise maybe be excluded from some of that information because of socioeconomic background or language barriers.
We serve the underserved community. We assist them with not only making their mammogram appointments, but keeping their mammogram appointments.
Women don't go, and that's something that, is going to save their life. Just a simple screening can save your life.
When I was diagnosed, I had 3 lumps. What if I had just decided to ignore it? I think about that every time I meet a woman. I tell them, I understand because I've gone through this journey. It's just so much information coming to you at one time, and you're still trying to process, I have a diagnosis. I tell them, I will even go in the room with you. Whatever I need to do to make sure that this patient feels comfortable.
We invite speakers from all over the world to talk about the latest trends, best practices, research and innovation. We currently are able to offer continuing education credits for healthcare professionals. We offer them for social workers, for nurses, for mammography technologists, certified community health workers. So we really want every level of individual professionally that's involved in the care of a breast cancer patient to be able to come to the summit and get something out of it that they can take back to work or take back to home or their community and share.
We hold webinars on the 4th Thursday of every month. We also have a newsletter for all the breast health organizations. They'll send us their information and they want us to include it, and we'll add it to our calendar, and we'll also add it to our newsletter so everyone around the whole state can see what's going on.
I actually created the 4th Thursday webinars. The idea was that we should do more educational outreach besides the Breast Health Summit every year. I think it's evolved into something fantastic. This is an opportunity when an event is coming up. Groups can come talk about these events, educate everyone, or if there's a hot health issue, like when healthcare reform was coming out and Obamacare, people had a lot of questions. So it's actually a very nice venue where we can talk about a wide range of topics.
The lifeblood of our organization is our fundraising, our annual Breast Health Summit, and the money we're able to raise in the community. Every dollar makes a difference to us. We're able to serve so many more women, so many more breast cancer survivors, reach so many medically underserved communities throughout Texas.
Breast cancer is such a common disease that almost everybody is touched by it, whether you've gotten it or a friend has gotten it or a family member has gotten it. Everyone is touched and affected by it.
It's everyone sharing one voice that's going to make a difference, and I feel like through the Breast Health Collaborative of Texas, because the network and the connections and the tying together is so strong, we're actually making that impact.
We have one common goal, and that is breast health.
Join us.
Teach Tarfua Lenu.
Join us.
Mời các bạn tham gia vào chương trình.
Join us.
Únete con nosotros.
Join us.
Join
Join
us.
us.